What we're going to be talking about today are the risk factors for recurrence of C. difficile infection. And I typically like to group these risk factors into categories similar to the risk factors for initial infection. And these include demographics, medication exposures, bacterial factors, and environment. From a demographical standpoint, people over the age of 65 are at increased risk for recurrence for reasons similar to them being at increased risk for initial infection. Specifically, people over the age of 65 receive medications commonly associated with C. difficile infection, as well as people over the age of 65 have medical comorbidities associated with the infection. Any individual who has an immune compromised state, either a medical comorbidity or a medical condition that leaves them immune compromised, or a medication that might weaken their immune system. Any individual who's had C. difficile in the past is at risk for recurrence, and those with severe underlying medical conditions. And this can take the form of multiple medical conditions or one medical condition that is severe in nature. From a medication exposure standpoint, antimicrobials are commonly associated with recurrence for reasons discussed in a different segment. Specifically, the so-called concomitant antimicrobials. These are antimicrobials that are given either at the same time as the treatment of C. difficile or within 3 months in the future for other indications other than C. difficile infection. Any acid suppressive medications, specifically histamine blockers or proton pump inhibitors that are commonly given for gastroesophageal reflux disease, so-called GERD, dyspepsia or epigastric pain, as well as peptic ulcer disease. Bacterial factors also play a role in recurrence. Specifically, there are certain bacteria that are so-called hypervirulent strains of C. difficile. NAP1 BI027 is one such strain that we see. These are strains that are associated with increased risk of 30-day poor outcome, defined by colectomy, removal of the colon, or mortality, death. When individuals get these strains, they have more severe outcomes, but they typically also will have a higher risk for recurrence. In addition, there have been reports of antimicrobial resistance, and the resistance patterns are seen more frequently in the antimicrobials that are used to treat C. difficile less frequently, specifically not the antimicrobials metronidazole, vancomycin, or fidaxomicin, but more frequently with an antimicrobial such as rifaximin that is not frequently used to treat the infection. And then finally, environmental factors play a role. Specifically, was the infection acquired in a skilled nursing facility or a hospital? Within these environments, individuals are surrounded by the C. difficile more often because other individuals in that environment either carry the infection or have the active infection, and it's a large group of individuals who are all susceptible to infection because by definition they wouldn't be hospitalized or in a skilled nursing facility if they were otherwise healthy. And through the LESA study, looking at the Emerging Infections Program, we saw that individuals with healthcare associated infection are at statistically significantly higher rates for recurrence of C. difficile. As a patient, understanding these risk factors for recurrence and thinking about them will allow you to have a good dialogue with your healthcare practitioner about reducing risk factors for recurrence in the future and aggressively treating your infection.